excited to welcome today Dr. Ray Newman. He is the chair of the public, now tell me, I might get this wrong. I was trying to make sure that I got it right. It's the chair of the Department of Population Health at Sam Houston State.
Yeah,
Did I get that right?
that's correct.
Perfect. Okay, and Dr. Newman is joining us today because in an effort to continue to provide students with more opportunities to pursue degrees in the healthcare community, they're now offering a new degree, and it's called Master of Public Health degree. So Dr. Newman is joining us this afternoon to talk a little bit about what that means and how this is going to help students in the future. So thanks for being here. I appreciate you taking some time. I know that there's a lot going on in the healthcare industry world, so thanks so much for being here.
My pleasure, Erica. Thank you.
So first off, I want to ask you, what exactly is a public health degree, and why is Sam Houston State offering it?
This is actually a very popular degree. Public health, as you may know, is the science and practice of protecting and improving community health by researching injuries and diseases, developing educational programs to address those, implementing policies to help prevent or minimize them. It's an effort that's oriented toward the community. It's not fixing problems with patients who come with broken legs or colds and such. It's the effort to try to prevent communicable diseases and protect the health of all citizens on a community basis.
And obviously we need a lot of that, especially right now as we've been dealing with the pandemic for about a year now.
Yes.
So it's a 42 credit hour program completed in 22 months. That's 4 semesters and a summer one. Now, I don't know a lot about degree plans. Is this a normal path in order to pursue this type of degree?
It is. It's a less than 2-year program. If somebody goes full time, that is 9 hours a semester and 6 in the summer. So it's a relatively short program to complete. 42 hours for accreditation purposes is the minimum number of hours. Some master's programs are shorter than that, but to be accredited, we have to subscribe to the 42 hours of different kinds of courses, and that's why it's set up to finish as soon as possible.
And what kind of jobs can students receive after they complete this program and get this degree?
There are a lot of options that graduates have in this. At one point in time, years ago, it used to be only going into the pure activity of public health, like with the public health departments and such. Today, it's very broad. It can include hospitals, clinics, government work, insurance agencies. It's a very broad-based program with the knowledge that's developed in the program that students can use and go into a lot of different settings.
And why do you think that these kind of jobs are so important right now? Especially, we mentioned, obviously, we're dealing with a pandemic. We're trying to put an end to that, vaccinate people. Why do you think it's so important?
It is very important because the need for developing a knowledge base and policies and practices to help prevent those is extremely important. It's an area that needs to be developed further, get greater support for public health practices, as well as funding the programs that are designed to help the communities prevent these diseases. And as you stated a couple of times, this pandemic has really focused the need for public health policies and good practices to be into place. And that's where a lot of the research orientation that the practitioners have in this area is to combat the diseases that we've been dealing with for quite some time now.
You were just telling me before we started the interview that you've actually been interviewing medical student candidates for the med school there. What has that been like for you over the last year or so? Has there been an uptick in students that are interested in going in this type of field? And is it due to the pandemic, or is it just, do you think that this is kind of normal?
Only historically on the physician side, we've been under-physicianed, if you will. So the demand for access to medical schools has been great with a limited number of slots available. That area has been growing with more seats available. And the medical school at Sam is relatively new. It had its first cohorts of students this year, beginning last fall. So we're now interviewing for the second cohort that will begin next fall. The first cohort consisted of about 75 students. It'll go up to 100 with the second, and then up to 150 students after that. But there is a big need for it because the demand for physicians has continued to grow and is still undersupplied. So the demand is there. Now, on the public health degree side, of course, the attention has been increased tremendously over the last year because the focus has been on public health, and it's been on the news front every day, as you know. So it's created the interest and the demand. We've seen our enrollments in particular courses go up because other students want to learn more about it, even though they may not be public health students.
So is this a degree plan that students can pursue now? Is it something that you're still planning? What's the timeline here?
The timeline is very good, actually. We just received approval last spring, last summer, so we implemented the program in the fall semester. So it's open now. We're taking enrollments. We've already got about 25 or 30 students enrolled in the program, and we're just now starting our advertisements and our program to, or the public announcements to attract students. And it's designed, the master's degree is designed for working professionals who want to learn more about the administrative side of things as well as particulars in a public health master's program, not only to advance their careers, but to learn more about the management side and to become qualified for other things. So it's attracting many folk from the working medical profession that's been out there 5, 10, 15 years. And we very often in programs like this see physicians, nurses, pharmacists, lab techs, a cross-section of medical professionals who come in to earn a master's degree in this area.
Well, Mr. Newman, I got to tell you that as a Bearcat myself, I am so proud to be able to hear over the last few years how SAM is just booming, especially in the medical field, to hear about this and the med school that just started last fall. Proud to be a Bearcat and an alumni, and to see that hopefully more students are going to pursue an education there because now there's so many different options. So an exciting time
Yes.
for Sam Houston State University, that's for sure.
It is, and we appreciate very much the attention that you've given us and the opportunity to share this with you.
So if there's anybody watching right now, I want to make sure I ask, and they're interested in pursuing this, what are some of their first steps that they need to take?
They can apply to the program. That's online at the Sam Houston State University website. They can gain access to that. Everything is through the online approach. They can also contact the department, and we'll be glad to give any information that they're looking for. So we're ready to talk to them.
All right, Dr. Newman, we actually lost your camera, but we still heard everything you said. So I'm going to make sure that we have all that information online. Dr. Newman with Sam Houston State University, the chair of the Department of Population Health at Sam Houston State University. Thank you so much for joining us this afternoon.